Cool. Good morning, everybody. This is Rolando Mia with Xyrus, and we're here with Dental Voice. Today, we have a special thing for you, just a quick topic, and the topic is tips from Dr. Tom Hirsch, the inventor of Isolite. The thing that we want to cover today is this issue of aerosols and Isolite. With the appearance of COVID-19, right, there's a realization that it can be spread through aerosols and droplets. And these droplets can contain biologics, bacteria, viruses. And recently, we've received a huge number of questions about how Isolite, or if Isolite can get rid of the aerosols. So we have Dr. Tom Hirsch here. And the question, Dr. Tom, is this. Can you give us and share your thoughts on how Isolite can help eliminate aerosols?
Absolutely. Good morning, Rolando. Good morning, everybody. I'd love to take the time to share with you what's going on with the airborne aerosol situation. First of all, with Isolite, I've been using it for about 20 years now, but I wasn't using it to eliminate bacterial content in the air. I was just trying to keep the mouth dry and isolated and reduce the humidity within the mouth so I would get better bonding and better dentistry. But now, since we've got COVID-19 that we have to deal with, it's really important that we keep all of the airborne aerosols in the mouth and not out into the atmosphere. And Isolite does a wonderful job doing that. In fact, we have some studies that have shown that we reduce airborne aerosol by up to 90% by having continuous evacuation within the mouth.
That is awesome. So when you talk about continuous evacuation, how does Isolite do that, or what's the context around Isolite doing that?
The way that works is the Isolite is connected to the high-speed evacuator. You can have a second high-speed evacuator if you want. But once you put the Isolite mouthpiece in the mouth and it's connected to the high-speed evacuator, it is turned on 100% of the time. We have the ability to adjust the volume, turn it on or off right here at the side of the mouth, with a couple of levers that the Isolite has, but we have continuous 100% evacuation. Now that's really important. Here's the reason why. If you're only using an HVE to evacuate, the only time that the HVE is evacuating efficiently is when it's in the mouth. You have the airborne aerosol and you put the HVE in the mouth and it evacuates out, fluid, debris, scatter. But once you take it out of the mouth, it's no longer effective. The patient is still breathing into the atmosphere. And as we know, the droplets in the atmosphere can be there for up to 3 hours. So we want to keep as much of the airborne aerosol out of the atmosphere, out of the ambient air, and within the mouth. And that's what the Isolite does. Continuous high-speed evacuation, always on, always sucking in from the outside and reducing the spatter that goes out of the mouth.
So from a use perspective, what tips would you give to people to either improve, enhance, or things to remind them about utilizing the Isolite to maintain that evacuation and elimination?
Well, once I put this in the mouth, one of the things that I've found extremely useful, this is a quick little tip here, is if I take an Isolite, regular old medium Isolite right there, I'll take a couple of gauze squares and I'll put the gauze square right in between the flap of the Isolite there on the top, and I'll put one on the bottom. And what this does is this just kind of acts like a little sponge, and it doesn't matter that it's hanging out like that because you can just tuck that in. But this acts like a little sponge, just absorbing anything that might have a tendency to bounce out of the mouth off the plastic, or it'll just sucks everything up. You'll get this wicking effect from the gauze squares. So that's one of the things that I do, and it's not unpleasant or uncomfortable for the patient at all. And then the other thing, as I said, once this is in the mouth, I keep the vacuum on all the time. My patients will even say, my mouth is really dry after the end of the procedure. They'll go and say, damn, my mouth was dry. And you know what? It is dry. It's really dry in there. And I've had it in my mouth, and I've had it used on me. And man, I take that thing, all I want to do is close my mouth and lick my palate, get the tongue up in the hard and the soft palate so I can swallow again. So it's dry.
And if I understand correctly, dry is also good, because we've also heard with it in there, it also eliminates, or how does it eliminate spatter, or does it affect spatter?
It really does eliminate the spatter quite a bit. So when we have spatter, one of the things that I do in my office is I am now adjusting down the amount of spray that's coming out of the handpiece. I have that down really low. If I can cut dry, I'm going to cut dry. But most of the time I don't want to cut dry because I'm generating too much heat, and then I can risk killing the tooth and devitalizing the nerve of the tooth, necessitating a root canal. So I don't want to do that. So the Isolite, by just reducing the amount of airborne air, the amount of water spray coming out at the end of the handpiece, that's one of the things that I do. I keep that on the lower side. Before, it used to be a tsunami in the mouth. I mean, I had so much water in there because the Isolite was so effective in evacuating the water. I didn't care. It could be a tsunami. I could have all the water that I wanted. It kept my preps really clean, and it vacuumed it up. But now I don't have that luxury of doing that anymore. Now what I have to do has to be turned down a little bit, and we'll be back in with a 3-way syringe more than we used to be, just kind of cleaning things up.
So that's cool. Thank you for that. So first of all, constant evacuation, you put it in, turn it on. Can you use we've been asked, can you use the handheld HVE in addition to the Isolite?
Absolutely. My assistants, I don't need it, but my assistants, they're standing by if we definitely need, if she can see anything coming out of the mouth that the Isolite hasn't picked up. I mean, you can imagine what things look like. We're wearing a face shield, and we have the face shield on. If we hadn't had the Isolite in it, the thing was really scattered and dirty at the end of a procedure. But now the face shield comes out relatively clean at the end of the procedure if we're utilizing the Isolite continuously. But yeah, she's still there, and she can still, a little bit more doesn't hurt, because you can have 2 ports, one for the Isolite and one for the HVE, and a little bit more just held right outside the mouth. Can't hurt a thing.
That is awesome. So from a tips perspective, put it in the mouth because it's constantly evacuating because it's connected to the HVE. I heard that, correct?
Oh, one thing that I forgot to say.
Oh, sure.
When you put this in the mouth, the Isolite seals off the back of the throat. So any particles that are in the back of the throat, it just stops them from coming out of the mouth. So any viruses that may be back there are still contained back there as much as they possibly can be, because this thing blocks off the entire throat, so you don't have anything coming from deep within the in the lungs, or any airborne particles coming out. It's kind of sucking them all in.
Awesome. So thank you for that. So constant evacuation covers the throat, so even breath and stuff doesn't come out.
Right.
You can use it with the existing HVE. With any kinds of scalers, with rotor instruments, handpieces, with abrasion, that type of stuff, it will work because it does that. And a couple of tips, the gauze on the side, in the event that you need more coverage, if I heard correctly, is that right?
That's right.
And then also, you're decreasing the amount of water a little bit because it lets you do procedures without generating so many.
Exactly.
Anything else?
Well, let's talk about that. Let's just go to hygiene for a moment. Hygiene with, as you were saying, and you reminded me of that, we have our Cavitrons, we have our air polishers, our piezoelectric scalers. All this stuff just generates spray in the mouth. So it's really important, because hygiene is a big area of, we have so many hygiene patients that come in every day. Each hygienist sees a patient every hour. So we've got 16 hygiene patients coming in a day. So that's 16 points in my office of more contamination. So the hygienists just love this, because that reduces the airborne aerosol from those things that generate airborne aerosol.
Awesome. Well, first of all, thank you. Thank you, Dr. Hirsch. To sum it up, the tips that you gave us, if you were the top 3, top 5, what would they be?
Okay, the 3 top 5s, put the Isolite in the mouth and do continuous evacuation. That's number 1. Number 2, put the little gauze squares on the side of that.
If you need it, right?
If you need it, that's number 2. And number 3, make sure you protect yourself. Protect the dickens out of yourself, and have your assistant there, and she can be there with that little second port, HVE port. So be protected, be safe. You've got a family, home, kids, family, staff. Everybody wants to be safe. We all want to get out of this thing alive. It's very important.
Thank you, Dr. Hirsch, and really appreciate that.
Rolando, thank you.
Yeah, those of you who are watching, if you have any questions, please feel free to post them on and we'll come back and address them. We're going to continue this series. If you like it, let us know. If the information that Dr. Hirsch gave you here was helpful, please go ahead and share it with other people. Feel free to continue to come to us, ask the questions. Thank you so much for everybody who's been giving us comments about this. We will continue this process. Please join us when we do the other things, and everybody stay safe. Thank you so much, Dr. Hirsch, and it was great to see you.
Rolando, thanks. Talk to you too. Take care, everybody. Everybody stay safe.